Hello, welcome back, everybody. We're glad you could join us for this next session as we start the strategic planning part of our day today. So what we're really excited about this next presentation to get to introduce to you a new tool that's being developed out of the network by some of our colleagues here. So we just want to say that for this portion of the day, we are going to be engaging in some activities that will orient your teams to these tools and do some of this planning. So to do that, it would help us as you're logging in, if you could please add your organization name to the end of your Zoom name. And that will help us to facilitate some of the breakout sessions that will come later in the day. So if you can do that, the three little dots that appear at the top of your face, your screen of your video, you can use right or click on that to allow you to rename rename yourself and add your organization to the end of your screen name. And now moving on to our next presentation. Again, I'm very excited to introduce to you Dr. Kristen Scarmadalia. Good to see you again, Kristen. I'm excited to get to hear about our this orientation to the organization well-being inventory. It's a tool that we're very excited to introduce today. So introductions to your presenters today. We have Dr. Kristen Scarmadalia is an assistant professor at the University of Maryland School of Medicine. She has extensive experience working with high needs youth and their families as a school psychologist in both the public schools and juvenile services. Her research focuses on the intersection of the education, juvenile justice, and mental health systems, such as investigating district-wide strategies to reduce exclusionary disciplines practices. She also provides training and technical assistance to states and school districts on developing and improving comprehensive school mental health programming, with a particular focus on compassion fatigue and educator well-being. For this presentation, she's going to give us information on the background of how the WellBeing tool is developed and how we might use this. She will also be joined later by her colleague, Dr. Charlotte Swilley, an assistant professor and senior research policy at the Center for Child and Human Development, Department of Pediatrics at the Georgetown University School of Medicine, and Director of Provider Wellbeing for Early Childhood Innovation Network. Dr. Charlotte Swilley's work is co-situated at Children's National Medical Center and the Early Childhood sector. She's operated as one of the lead psychologists to implement Healthy Steps in Washington, D.C. at Children's Medical Center, and now serves as a technical assistant specialist to other Healthy Steps site directors in the District of Columbia. You can read a little bit more about their work and information here on our slides. We'll go ahead, and without too much further ado, I will go ahead and turn this over to Dr. Scarmadalia, sorry about that, who will introduce our session for us today.
Thank you, Dr. Clark. I appreciate it. Good to see everybody today. I'm not actually clear that my PowerPoint is, there we go. And hopefully now you're seeing the actual slide, not the presentation mode. So just a quick acknowledgement before we dive in. This is the team that has been working on this tool. Again, Dr. Charlotte Swilley, who is in a training this morning, will be joining us in a little bit for our first breakout sessions and then for our conversations this afternoon. Dr. Hoover and Oscar Morgan have been leading this work and have been great supports. And then we have also had support from our postdoctoral fellow, Katie Trainer, and one of our new interns, pre-doctoral intern, Chantel Smith. All right, so well, I guess we'll hang here for a minute and I'll just kind of bridge for you. My background is clearly in education and schools, quite a bit in juvenile justice also. And where this work came from is I was doing a lot of work around educator well-being, and probably somewhere around a year ago or so, Oscar had come to us and said, you know, look, we're having a lot of requests from behavioral health organizations also. And we start taking a look, and the two systems are incredibly similar as far as what the demands are: high needs, low resource, significant exposure to compassion fatigue, trauma, burnout, right, for educators as well as behavioral health providers. So like, I think we can take a lot of the materials we've developed and adapt them for behavioral health providers. We started that about a year and a half ago, did some trainings and seemed to go well. So we then got the opportunity to really formalize, standardize this, this approach to well-being into a web-based portal. So what we're not going to talk about today is we have a whole individual side. I'll give you just a little brief idea what that is. But as we talk about, self-care and compassion fatigue and what we can do for ourselves, there always has to be that recognition that this is not something that an individual can do for themselves 100% completely, right? There's a lot we can do for ourselves, but organizations have to create that space, maybe support. There may be organizational factors that need to change, right? It can't all be on the individual. So that's how we got started in this, got really interested in this. Our first step was to go back to the literature. I heard Shanafel referenced earlier today. I got a chance to listen to some of the panel this morning. And what we did is we culled the research on organizational well-being. And our colleague and partner, Dr. Charlotte Smileys, has been doing a lot of specific work for quite some time in organizational well-being. And the first question is, we know things that matter for organizational well-being, but how do we begin to kind of distill that down into actionable items? So, the first thing I've got here is a little bit of background. I think between yesterday and this morning's panel, a lot of this has been discussed. So I don't want us to spend a whole lot of time repeating what you've already heard. We know that healthy workplaces is one that maximizes integration of employee well-being and company objectives, right? It's not alongside the company objectives. It is part of what the organization is doing. Job satisfaction, work engagement, higher levels of energy, more enthusiasm, positive morale, right? I mean, there's all kinds of positive benefits that come from this, including at the end, right, our patient and client outcomes. And helping professionals face increasingly high rates of stress, burnout. We started doing this pre-COVID, and there's a lot of interest, and we did some trainings, and things went well, but there was always a sense that we have to kind of sell this, and gee, this stuff is really important. COVID happens, and now the requests are, we're overwhelmed with requests, because what was thought of as, it would be good if we would do some things to support the well-being of our employees suddenly became an absolute critical. We are losing people at rapid paces. Folks in behavioral health, I think, have taken a particularly hard hit with everything that's gone on with COVID. And this is now really foremost on everybody's mind. And the diagram there on your right just is a little path model about healthy workplaces that then load onto both employee well-being and organizational improvements. But we want to stay pretty concrete today. So what's our goal, right? Create this web-based platform for behavioral health providers. We want something that organization and organizational leaders can engage in on their time, at their pace. It's not an 8-hour training that you have to figure out how to fit into your day, hopefully be able to attend it all, and then sort of figure it out on your own from there, right? This is something that persists. You can go in, you can do some assessment of your organization. There's resources to help you through that. You can go back in. Maybe you decide you only want to look at one area or start small, but this makes it much more flexible and much more accessible. This is some of the literature we were looking at as we start to consider, what do we mean by organizational well-being? What impacts employee well-being? What organizational factors impact employee well-being? And then where our filter became very important is, and what elements of organizational well-being can a single organization feasibly, reasonably impact, right? Because we don't want to be identifying and working on factors and saying, oh, this is really, really critical, but it's not actually something that an agency themselves can change. So for example, and I think I heard a little bit about this on the panel this morning, A lot of stress comes from billing, Medicaid restrictions, right? There's a lot there that is stressful in our organizations. But if we were to say, gee, it would really help a lot of things in our organization if the Medicaid reimbursement rates were higher, because then we could afford XYZ. Yes, that's all true. But there's not, one agency isn't going to be able to change the reimbursement rates. So to set that up as a factor to work on doesn't set anybody up for success. Now, what we could do is take a look at, is there a shift in roles where we could provide more administrative support, carve out more time for that, issues around it. But we really try to come at this with a lens of what can a single organization on their own reasonably improve. So not all of this made it through, even though we want to understand in a more global way what is impacting employee well-being. There certainly are global factors that play into it. All right, so we distill all this down, right? And this is where we start to get a little more hands-on. These are the 8 domains that we distill from the literature. To be a domain that we identified, it had to load significantly in the literature onto well-being, like, yep, this actually does impact both employee and organizational well-being, and the elements that we define under here are within an agency's control to do something about, to change, to expand, to extend. We represent it in a circle because there's not an order here. There's nothing that's more important than the other. There's not you start step 1 with this domain and then step 2 with that domain and go through. This is completely organization dependent. Your organization may be working in some areas and working really well in some areas. And I apologize if you're hearing my cat have a little fit in the background. She has started hollering. Yeah, so these are the 8 domains we want to think about. But again, it's not a step 1, step 2. This is a point we are going to hammer at throughout this presentation, and particularly when we get to talking about diversity this afternoon. There are things that help everybody, but it's very unique to each organization where you want to start, what you can do, what you want to work on. So these 8 domains break down into professional development and recognition, right? So having the training that you need, being recognized for work, and having a sense of reward from your organization. Organizational and supervisory support, right? What level of support are you getting from your organization, from your supervisor? Is it like purely admin, you only know when you're doing something wrong? Or is this a space to help problem solve and improve your working conditions? The work environment itself, the physical environment, but also sort of the climate at work. Quality of life, and really this is professional quality of life, right? So I feel good about what I'm doing, or not good about what I'm doing, it's a little more purpose. But my life, I'm energized by what I'm doing. My quality of life at work is one that is comfortable and positive. Diversity, equity, and inclusion. I did hear a great conversation about that in the panel. Absolutely one of our domains. And because we want to acknowledge that we can take the temperature in our organization, but we've got to be a little cautious about sort of doing a big average of everybody. Folks experience different things within our organization, and depending on groups that you identify with, this may be very, very different for you than for others in your organization. Self-care and self-compassion. This is where we see some of that overlap with individual well-being. Certainly self-care is something we think of at the individual level, but there are things that organizations can do to help support an employee's or staff's ability to engage in that self-care. So that's where that overlap is here. And then purpose and meaningfulness, right? We need to feel meaning in our lives. And we know that just in general, it's not specific to behavioral health or to education or to IT fields. Like, you've got to feel some sense of purpose and meaningfulness in your life. As folks who decided to get into helping professions, this is particularly important for us. So taking stock of, is the organization able to support you having that sense of meaning, right? Or if you are surveying your employees and everybody's like, and all just doesn't, I don't feel like I have a purpose, this doesn't feel meaningful. What can you as an organization do to shift that? All right, let's keep going. So this is a mock-up from early on. In fact, you'll notice there's just a lot of placeholder text, but I just wanted to give you a sense of what this would look like. There is a single home page, whether you would go in as an individual provider or you would want to go into the organizational side. There's a kind of a one-stop shop landing page, and you would click into organization and then follow the assessments and guides there. For the individual provider, this is a 10-part self-guided workbook. There are self-assessments, worksheets, and self-care plan development. And on the organizational side, we really focus on evaluation tools to help assess these domains of organizational well-being, and then a resource repository, intervention repository, so that once you identify where you want to work, here's some ideas and tools and interventions that you can do to support that area. All right, the references there. Yes, and so I think we have 10 minutes until our breakout to kind of talk about what are we going to be doing. So I want to, what do I want to do? Yeah, I'm going to show you something different. What you're going to see in your breakout rooms, or what you're going to have, and we are, fingers crossed, sharing a link to the document and getting ready to share for you. So let me do that again, make sure that this, we've had a little bit of technical difficulty making sure that we can share files in the Zoom chat. Our organizations are not super excited about that. So I want to make sure you get to see this. Okay. There we go. So your breakouts, this first breakout, this is going to be different than this afternoon. This first breakout is organized by domain. So this is an opportunity for members of the team to go learn more about each one of these domains. We have 4 breakout rooms, and as we have a couple that are just logically grouped together. So one breakout room is going to be work climate and environment, and then input, flexibility, and autonomy. Second, or another, not necessarily in order, another breakout room is going to be around professional development and recognition, and then organizational and supervisory support. Third breakout room around purpose and meaningfulness and professional quality of life. And then go up here, self-care, self-compassion is going to be in its own room. I have left out diversity, equity, inclusion, accessibility, because this afternoon we're going to come back and we're going to do a much deeper dive in a longer session all around diversity. So we didn't really want to get into that here until we've had an opportunity to really dive into that this afternoon. And so self-care then became isolated because this is the one that I tend to find there's the most conversation around. And it is up to your team where you want to go. So all of your team members could go to the same breakout. You can, strategically have one person in each one, however you would like to do that. There will be a facilitator in each room, and then Dominique and I are going to float. Dominique and I will float between the rooms. Certainly, if there's a question in one of the rooms, the facilitator can message us and we'll go over there. So I see the question in the chat, where's the PDF? If you scroll up slightly, there is a link to that. Let us know though if you're having trouble accessing it. Yeah. Okay. So we will get to those in a moment, but I just want to go back to what the actual task will be and what you're going to be looking at. Hopefully everybody has had a chance to now get this PDF. All right. There we go. So when you go into your rooms, right here again are the pairings, the work climate and input, professional development, organizational and supervisory support, purpose, meaningfulness, professional quality of life, and self-care. And then diversity we're going to do later on this afternoon. The links that you see here that are also active on your PDF are to give feedback on the items. So I've left 2 spaces for you. On the PDF, you'll notice at the end of each domain, there's just an open text box This is just simply if you want to take notes, if there's thoughts you're having, you want to make sure to put under domain. That's just there for your own note taking. But also, if you're so inclined, we are still in this kind of development review process. We've been through this iterative review, and we would love to hear your feedback. So if you get a moment and have things to say, there is a link for each one of these sessions just to either drop comments, rate items. We would love to have that feedback. We should be going into breakout rooms in about 5 minutes. So let me pause here. Clear as mud. Do you have questions? Does this kind of making sense right now? And I'll just wait to see.
Kristen, really quickly, if you could you just briefly remind folks, we have the different domains, we have the feedback opportunities within the session itself. The task will be.
Yes, there we go.
Thank you.
Right. So the task itself is to review the items in your domain. And as you're reviewing those, when you were thinking about, we'll just take like organizational and supervisory support, did these items capture what you would have thought would have been in there? What is not captured? And then were there any kind of surprises or aha moments? Often when we look at these various assessment items, it's like, I never really thought about that for our employees, but that's really interesting. I wouldn't have considered that, but now that we say it. So answering these 3 prompts, if you are in one of the 3 rooms that has 2 domains, you want to take about 10 minutes per domain. And then the self-care one, obviously you'll have the full 20 minutes. We will also copy these prompts into chat so that you will have the, whatever you have in chat will remain then on your screen once you go into your breakout room.
And I think we can go ahead and head into those breakout rooms if you're ready for that, Dr. Scardamalia.
Yeah, I think we're ready. And I'll just to give you a preview this afternoon, this morning is by domain to learn more about the domains. And this afternoon, you are going to have the opportunity to meet with your team and start thinking through what this means for your agency. So if that is something that's like, oh, but we really wanted to be able to be together, just know you will get time to plan as a team together later this afternoon. So you can strategically pick your domains this morning.
Excellent. I got the opportunity to get to hop around from each of the different rooms, but it seemed like very lively discussion. And so I hope that felt very engaging for you to get to the opportunity to look at the tool, to see what's included, and to provide your thoughts and feedback. I don't know if Chris, if you have any comments or questions you want to ask or make of this group. I know we're going to take a break here in just a moment. I know I need one. Anybody have any thoughts or comments from your discussion that you want to share very quickly before we take a brief break?
And I'll just say I really appreciate the conversations that were happening as I popped into various rooms. I got some really great feedback. So thank you guys.
Thank you, David, for that comment. Again, your feedback is invaluable to us, so we appreciate that. Before we go on break, what I will suggest, please just mute your camera and your mic, but stay logged on. So we don't have to transition or do anything else today. Just stay logged on. But we're going to give everybody a 10-minute break before we come back. We're going to talk about the other domains of the tool that were not discussed in this group. Before then, we do some opportunity for team-based strategic conversation and planning around how you can use the content you've learned about with this tool and really the last 2 days. So we'll come back here, and my time, it would be a little after 12:20, 12:23. I know we're all in many different time zones, so about a 10-minute break, whatever time that is for you where you are located today. So we will see you in 10 minutes. Hopefully you're able to hear as we're getting connected for our next session. So the next portion of our discussion is going to be focused on the domains related to diversity, equity, inclusion, as Dr. Amelia had mentioned earlier today. And now she's going to be joined by our colleague, Dr. Charlotte Swilley, to talk about what we can a presentation on considerations, moments of pause, and reflection in addressing DEI in your organization. So this presentation is really going to allow us to take a deeper dive into the domain of diversity, equity, and inclusion and how it relates to the use of this tool. And so with that, I think our presenters are with us now. I'll go ahead and turn the floor over to you.
Thank you, Dr. Clark. So I am super excited to be joined by my colleague, Dr. Charlotte Swilley. I know we heard a little bit about her and her work this morning, but we actually get to have her in person now. So without further ado, I'm going to turn it over to her for the beginning of our session.
Thank you so much. I heard that the earlier sessions were just wonderful, good feedback. And although that you have been given a break, we really want to start this work and this conversation with a 1-minute pause. And when we do this work of DEIA, we start with pause. And the 1-minute pause is really an opportunity for all of us to think about the intention of being in this space today as we embark on this conversation that sometimes is heavy, quite honestly and quite frankly. And so I will keep the time, and in that 1-minute pause, just really arrive in the space with intention and think about what is your intention for this conversation today. And I start now. Thank you, everyone. Next slide, please, Chris. So we're, again, so grateful to have this moment to talk to you today about diversity, equity, inclusion, and accessibility. So we know that so many organizations are really navigating this conversation right now. How do we embark on this? What are the elements of this? How do we focus on DEIA? So we hope today to give you a starting point for the framing of this conversation as you decide, is this your time for your organization to embark on this? And maybe if it is, then how do you engage in the conversation? So the first principle we want to share is to understand that DEIA work is not following a series of steps, not a checklist of a series of steps. We all have specific programs, we have great curriculums, and they follow steps. DEIA is not one of them. DEIA work really needs to be deeply contextualized and based in each organization's history, the need of your organization, your policy, what your practices are, the families that you serve, children, if any, and the like. And so those are important considerations. So what one organization may do in terms of embarking and grappling with DEIA may look very different for another organization. And it often is really a challenge for so many to see that there is not a checklist, that it can be, and it often is, in uncomfortable conversations. And if you embark on this, I think one of the key things to keep top of mind is you must choose to be uncomfortable in the midst of the discomfort. So with that said, here are some points of consideration that we would like to share with you. As I alluded to, this is really not a sprint. It is a marathon. And it's part of that marathon is knowing how to breathe. I am a runner. I've been running. I've done a couple of Army 10 milers, a couple of half marathons. So I understand the importance of breath and breathing in getting through that endpoint of that marathon. So really, pause is such a critical point in this conversation. Creating deep, lasting change takes time. It takes time. Deciding for 1 year or first couple of weeks or months, rather, this is what our organization is going to focus on. Really, if it is not an opportunity to think of this work as fast changing, it is not that. Instead, it is an investment in time and resources. Next slide, please. And so I like to think about the 4 Cs of DEIA, the 4 Cs. Culture. What is the organizational culture and climate? What is your organizational culture and climate? Is this a difficult conversation that your organization is prepared for? The second C, commitment. Is the organization committed to really promoting an inclusive culture? Is that where you are at this time? Co-creation. It is a process. This is not a one woman, one man job. It is a co-creation process. And certainly one of the most important for this work is compassion. Tara Brach speaks of radical compassion, which means total compassion. Those are the 4 Cs to keep top of mind as you create this work. Chris, I turn over to you.
All right, thank you. So as we start talking about issues around diversity, equity, inclusion, accessibility, right, as Dr. Charlotte Swilley was really highlighting for us, they're difficult conversations. And so one of the things that we want to keep foremost in our minds as we begin the work is psychological safety. And I feel like psychological safety is one of those it's kind of become a buzzword recently. We're kind of hearing a lot more about it. But what do we mean by that, right? So it's a belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. One of the easy mistakes to make in this work is to, kind of jump on the bandwagon. We want to look at this and we're going to do a quick survey our staff, see where we're at. And what you get back is, yep, everything's good. Everything's fine. And you can take that and you go, oh, I guess everything's good and everything's fine. And we don't need to do more work in this area. Or we can ask ourselves, how confident am I that if somebody had some critical feedback around how our organization is addressing diversity or equity issues, how comfortable would they be sharing that? Do they feel like they can speak up and give critical feedback? And it's very easy to be like, oh yeah, I'd be fine if somebody gave me critical feedback. That's not the question. The question is there a culture that has been created at this organization where critical feedback is welcome and open, and it's okay to say things that might be uncomfortable to folks in supervisory positions? We've got to keep in mind power dynamics are always at play. Even if it doesn't feel like for you they're at play, they are always, always in play. So one of the places we have to start is we want feedback, right? We want to understand where we are. But the step before that is to create a climate and a condition in which you can get authentic feedback, where folks can say, I haven't always felt like I belonged here. Yeah, There have been microaggressions, just last week I was sitting in this meeting. We've got to have that feedback. And to understand is every group within your organization feeling the same way? Again, it's easy to do a survey. And if you're able to disaggregate by race, you might get a survey back and again, everything's just fine. But when you really look, it's like, oh, I got 20 respondents and 19 were white. So they think the culture around diversity here is great, but that I'm not hearing a perspective from somebody who is not white. So absolutely critical. But this can be the challenging part, to create that sense of safety where folks know that they can give feedback. When you haven't yet, you still need to get that feedback to understand what is safe for your organization. So something we have to keep really foremost in our minds. There we go. And this gets to the something is not necessarily better than nothing principle, right? We're very, in behavioral health, we're constantly doing things with, half of what we needed to do, low resource, we're always kind of stitching things together. And it's easy to sort of go along that way and be like, well, this isn't great. It's not exactly what I would have wanted to do, but it's better that we do something, right? Not with DEI work. We can do harm if it's not done responsibly, if we're not really understanding the emotion and feeling and what it is like to be at work, feeling not psychologically safe. So how we start this, right? How we even plan for this is in so many ways going to determine your success and how we end up. We have, been very intentional in the information we're choosing to highlight here to really try to get at, there is not a step 1, step 2, step 3. This looks different for every organization. And a huge part of addressing DEIA is this whole beginning planning part, right? How are you going to collect your information? How are you going to ensure that you're getting adequate information? So we start into this, right? And I've just made everybody really anxious. Like, oh no, now I have to worry about doing harm, right? I thought maybe I could kind of wade into this. So the next impulse is often, well, let me ask my colleagues of color, right? Let me go to them because they're going to tell me what to do. They're going to make sure that I don't do it wrong. And I understand the impulse, but one of the things we wanted to really bring up today is this is often where initiatives just fall apart right from the very beginning, because what you've done is you've tasked the folks who are dealing with the biggest burden with yet more work. And it's not just work in that, I have to fill this thing out or that kind of work productivity, but it's the emotional and it's the psychological work, right? It's the cognitive work that has to go along with that. So we don't want to burden our colleagues of color with leading, directing processes. And actually I want to expand my language there, right? Because it's not just color. It is anybody kind of sitting outside of that dominant culture, right? So that might be gender identity, that might be sexual orientation, that might be a host of other ways in which we feel different from dominant culture. But it can't be our first impulse to go, oh, tell me how to fix this. You tell me what I am doing wrong, and you tell me how to fix this. So first steps is really understanding what would systemic change even look like? What would that take? And there's a lot of education that we can do for ourselves and understanding what is systemic transformation, and taking that burden on, doing our homework, and then yes, absolutely getting input. Because I think that can feel really tricky for a lot of organizations. Like, wait, I'm supposed to get input, but I'm not supposed to ask for leadership. And that can feel like a very, very fuzzy line. And we're not going to be able to resolve that fuzzy line for you because it is fuzzy. It very much depends on who is in your organization, what has been the culture up to now, what are really the sticking points, and what has been the environment and being able to get feedback. So a couple points we made here. I may feel like you are being inclusive, but have you done your homework already? Have you really kind of looked into this? And just assuming that, certain employees are going to want to take this on, right? So we see in the university level all the time, it's the Black faculty that teach the diversity courses. And it's an automatic. It's like, well, obviously you want to teach this. It's like, really? Is that where their body of research is? Is that what they themselves have defined as their professional goals? And if it's not, then we're adding burden, right? We are now tasking them with something that's different, something that's outside what their professional goals were. And are we spreading the load then equally, right? Is everybody taking up extra time? Is everybody having to handle additional stress? Or have we made some presumptions that, well, clearly you're going to be more interested in this, and the rest of us can go on about our day, and then we'll just wait until you tell us what our DEI program is going to look like. All right. Yeah. So that leads us, oh, sorry. Okay, that leads us into like, how do we get started in a way that feels good for folks? I really kind of liked this quote here on the left side. There's a difference between interest and commitment. When you're interested in doing something, you do it only when it's convenient. When you're committed to something, you accept no excuses, only results. So whether we start off, and I'm really interested in understanding the culture climate here. We're interested in doing this versus we're committed to this because it's messy work, it's hard work, it is valuable work. It is absolutely valuable, but it's not going to be over in a month or 2 months, maybe even a year, right? This is long-term change that we're talking about. So we've got to be ready to stick in for a long period of time. When we think about commitment, it's not just understanding that this is going to be a lengthy process, but that there's time and money that's going to come into this. And a lot of organizations get themselves right away painted into some very sticky corners when they start developing committees and all kinds of extra work. And we're going to do all these things, but we haven't taken anything off anybody's plate. So this is now something I'm doing after hours or on the weekend, or I'm centering this and working on my other stuff after hours or on the weekend. So again, the planning stages are critical. How are you going to create space? What are you going to take off of folks' plates as a trade-off for this work that they're going to be doing? And where's the money going to come from? Right? There are things that are best practices. Getting expert advice is one of them. And that doesn't come free and oftentimes not cheap, but this is an investment and it is a long-term investment. Having experts come in can be incredibly helpful, right? It's hard to see your own sort of organizational messiness, right? It's like having a family therapist. We need that person that's coming in who has no skin in this game at all and can give us an objective third-party view. It's a budget issue. And a lot of times that becomes a sticking point for folks. But we've got to just acknowledge up front, yes, we've got to find money and we've got to figure out where those priorities are. Because again, if we kind of go about it in a way that's, we're sort of doing it, we're kind of getting there, we can really frustrate. And the first question you're going to get is, so you're telling me that I'm supposed to believe that this organization is really committed to diversity, equity, inclusion, and accessibility, but you can't support the work, right? So you're going to tell me you're committed to equity and you're going to give me a bunch of committee assignments and not take anything off my plate. You're going to tell me you're committed, right? So the planning and how we enter this and how we set it up really is, it doesn't just set us up for success, but in the way you do it, you are messaging to your staff what is important to you. And I know everything we've talked about is very kind of gray and loose, right? And it can very much feel that it's like, but I don't understand what any of this actually looks like. So one of the many, many valuable experiences that Dr. Charlotte Smileys has had is being with and leading at various times this type of change work in her organizations. And so we thought it'd be really helpful to spend some time today listening to lived experience and examples of how it has rolled out in organizations that she has worked with. So I'm going to turn it back over to Dr. Charlotte Smileys to tell you about the work they've done.
Thank you. It is messy work, absolutely. But the decision for the leaders in an organization to really be committed, you're hearing us say that word, that C word, commitment to systemic transformation is not easy. I have been with Georgetown, specifically Early Childhood Innovation Network, for a little over 5 years now when the network started. And our leaders, as part of the network, the leaders of the network, was really committed to this work. It started with them being part of a Seeding Disruption Fellowship. And that's a fellowship that equip leaders with more skills to promote equity in general, and that recognizing that race plays a large part in equity conversations in DC. And then really having an external expert to come in and speak to us as a group and begin looking and deconstructing the things that the microaggressions and macroaggressions and really the deconstruction of all of that. And from there, we created a racial equity council, of which I was a member, and it was conversation regarding how do we bring this institution that is so grounded in research and servicing a community that has been historically marginalized, and we are putting in place innovative interventions that is specifically targeting communities that have historically been under-resourced. How do we bring research and practice together in the work when you have the foot soldiers who are doing the work in the community that are also Black and Brown, and those in leadership are predominantly white? What does that communicate? What does that say? And those were very hard and difficult conversations, but we had them. They were messy, but we had them. And what came out of that is really the developing in, of course, as at the university level, publication is an important component of our work. Being able to really do submit our voices for peer review, but to create a manuscript that speaks to how do we co-create, what are the steps of co-authorship so that it is clear for everyone. And that was another important conversation we had. But before all of that was really the notion of a shared language. How does our organization define racial equity? How do we define racism? How do we define cultural and health disparities? What are they? What is it that our organization wants to ultimately look at? And to have an organization, an expert, then come back. And we went through 2.5 days of undoing racism. That was hard, heavy, tears in the room. It brought up ancestral trauma, historical trauma that we carry. But to stay in the space and have that conversation, and from there emerge in creating a racial equity community of practice that continues to exist now. We see the efforts and where we are now. I also sit at another part of the university that is just starting this work. And it's really interesting to see how different it is, and to see how, again, going back to what we said earlier, this work of DEIA requires the pause to think about what is your culture and climate of your organization. What are you going to decide to embark upon? Is it cultural competency? Is it racial equity? Very different. We house ourselves in racial equity. And so those are just some of the examples of ways in which we struggled with this, and we continue to struggle with this. The commitment was to engage in restorative change, in restoring humanity. and really speaking of transformative relationships in our organization, and no longer engaging really in transactive relationships. So we are about to, yeah. Okay.
Yep. So when we thought about what we were going to do during the session, clearly there were some things we wanted to make sure that we got across. And to give an example of it, we also want to make sure we were leaving plenty of time for discussion around this, because it is something that a lot of folks are grappling with. For many, it's the first time entering into this. So if you were able to access the PDF earlier, go ahead and pull that PDF back up. And on the final page, you will see the items that are on the DEIA portion of that organizational assessment. And you'll see a repeat of the questions that we were thinking about with earlier domains. Like, do the items capture what you feel is important? What is not captured? And aha or surprises that have come from either what we've been talking about or the items. And then just to give you a preview, after I think we managed to, we're a little off time. So I'm trying to like readjust the math in my head, but I think we've got about 10, 15 minutes for discussion. And then you will go into, yes, absolutely, Shailene, we will we'll share that file again. We're going to go into a second breakout where you will have time to discuss things with your team. All right, so hopefully everybody's now had a chance. Oh, Felicia, can you share that again? I know Shelby had shared it earlier.
Yes, share. Just give me one moment to pull that up.
Thank you.
Thank you, Felicia.
I have to say, it's been an interesting tech day. So we will get that back out to you guys. So let me open it up. What questions have come up? There we go.
Thank you, Shelby.
I'll give everybody a chance to look over those items. All right, so, and you can certainly drop questions or comments in chat. I believe everybody can now, and please, organizers, correct me if I'm wrong, unmute yourself and ask a question. But right, this entire topic, it's all about people, it's all about relationships. So let's talk and interact around it. What have we raised your anxiety over? What questions do you have? And what is kind of sticking points for you?
Dominique and Chris, this is Oscar. Thank you for everything that you've done so far. Can you describe to the group the steps that we took to mitigate this issue in the actual tool? Because as you know, this is where we spend our time. And we've had some robust discussions about how we could make the tool user-friendly from a DIE perspective. It might be good for people to understand a little bit about the process and where we came out at the end.
Sure. Thank you, Oscar. That's a great prompt, because we had a ton of conversation around this, right? This goes back to that sense of psychological safety, and can you collect information where folks can be genuine and authentic, but then also feel comfortable doing that. So for our tool, when you first come into it, there's a registration survey where we do collect information about demographics. So everything from race, ethnicity, gender identity, sexual orientation. But we decided, sorry, I was looking at the comment
Go ahead. I'm looking at the comment while you're speaking.
Oh, perfect. Thank you.
Okay.
So, and then there, then the conversation, which was a lengthy one, broke out. It is that the organizational leader, do they have the ability to go in and say, okay, show me how all the white people answered, right? Show me how all of my Black staff answered. And that in itself brings up some issues. Because what if you, for instance, are the only Black male in an organization? So we have a disclaimer that says, your name and email isn't shared, but if you complete the demographics, you may be very easily identifiable, depending on sort of how many of you there are in an organization. So we have tried to split hairs here and allow people to disclose or not disclose, but give them that warning up front that the organization is going to see the breakdown. They won't have names, but they will see a breakdown. And so you can elect to not provide that information if it just feels more comfortable for you to do that. Dominique, Oscar, anything you want to add to that? We really went back and forth quite a bit.
No, we did. Yeah, go ahead, Oscar.
No, I was going to say Dominique may add more.
No, quite honestly, there was a lot of intention. That's what I would say, intention in creating this, because we wanted to really create a tool where there could be honesty, and a tool that would be really a launch for organizations to begin to think about how do we create things differently in our organization. And the way to start that is to ensure that data is disaggregated, that there is safety in that, and that there's no one that would walk away feeling like, I can't say this because there's going to be some consequences to what I'm going to say. So definitely.
I would just say the other thing on the other side is the reason why we wanted people to be able, if they so choose, to identify themselves by their race and ethnicity, if you will, is because that might be the issue that is not being discussed at the corporate level in terms of you may think you're welcoming to people, but you're not. I mean, we had an example once when I went to Arkansas, and the corporation was very concerned about the fact that clients, they were in a Black neighborhood, and they were very concerned because they built this fancy building and clients weren't coming in. And of course, they were losing money. That was their issue. And when you walked through the lobby, all you saw were cotton plants.
Wow.
And they were beautiful. They were in bloom. But they didn't understand that message.
Historical trauma.
And if you have cotton plants as the first thing I see when you walk in your door, then you have basically negated who I am from a historical trauma perspective. And there was no understanding of that. And so if you have one person of color that would say, check that off as an issue, then they can become the victim. Or even, more of an ostracized. So there is this delicate balance. And we just want you, as you do this work, to appreciate that and understand it, because unless you know the truth, you can't make the changes. And you shouldn't use this to weaponize your staff, but to help and support and lift your staff as well as your organization.
Absolutely. Thank you for those who have already provided comments.
Other questions or comments that are coming up?
Hello, this is Gary. Can you hear me?
Yes,
We
Gary,
can.
we can.
Yes, I had a quick question. Based on the comment that was just made about the pictures in the lobby and the organization sitting in a certain community, I've heard in the past organizations, entities are microcosms of the communities in which they sit. So, which one of the questions in this section kind of ties this commitment of the more global perspective of this organization sits in a community, and we in this organization take all of that into account when we do this kind of work? Is there a question there in that section that addresses the tie-in from community to this organization?
Great question.
Yeah, excellent question, excellent point, because I don't think we did tie that back.
No.
And I could see a question that says something like, does the makeup of this agency mirror the makeup of my community?
Mhm.
Something along those lines. Excellent feedback.
Yeah. Really good feedback. I think that speaks to the earlier comment around critical race theory. And
Yes.
in some organization and in areas where there are restrictions, and therefore the framing of that particular item 7 might be an issue for some states. So I think Gary, that brought me back to that original comment. So thank you for that comment.
Yeah.
Sure.
And
Thank you.
I don't, I don't know that we have a lot of clear guidance around the critical race theory issue. And I think that's going to have to be kind of a state by state, organization by organization. How restrictive has it become in your state? What are the potential consequences if you're moving forward anyway? And what are we willing to take on right now? And it feels like that particular issue over now having mandates that say what you can and can't say, right? This is creating a particular issue for DEIA work. The other thing that kind of going back to this idea of safety and who can comment and feel comfortable doing that, I think that transparency in how you set up your process, and I think about even with critical race theory, that kind of coming in, if from the beginning you're being very transparent, you're inviting feedback, you're kind of walking everybody through your decision-making process. This is why we're doing this. This is why we're not doing this. It does help have a sense of, okay, I understand how we're getting here. We always want to be setting our intention first, right? Because one of the little tangential, but one of the common issues you hear is something will get brought up as a critique. You're like, oh, we're so sorry. That's never what we intended, right? We say it's not our intention, and it feels like that's kind of supposed to fix everything. When we wait till after to say what our intention was, it's too easy to either truly retrofit it or make it feel like it was retrofitted. If I state my intention before I say anything or take that action, now you know up front what my intention was before I got your feedback, before I found out if you liked it or it went well. So transparency can be very, very helpful. The reason why comments about critical race theory can make me think that is depending on where you are, you may have started into some things, or if you're in an area that this is really being heavily mandated, this is where you might openly convene and say, look, this is work that we really wanted to get into. We feel is really important. We're not sure if we can do it well under our current restrictions. And really think about what is that going to mean. And I think this is truly regional and in some cases hyper localized.
Yeah. Felicia, thank you for your comment. Before I comment on Felicia, but what came up for me as you spoke about intention, your intent is sometimes and can be different to your impact of your language. And sometimes it's not about cleaning up your intent. It's about really accepting the impact of that conversation. And so I just wanted to kind of frame it in that way. And Felicia, yes, brave spaces, absolutely. Yes, and that is in the world of what we do. And we often speak of brave spaces because sometimes you cannot create a safe space, but a brave space where there's an opportunity for that learning experience to launch that conversation for accountability. Absolutely. Thank you for bringing us back to that language.
All right, so I believe this is the time at which we were gonna switch activities again. So if there's any kind of last comments, questions. Just as I say that, I see a big comment in the chat.
Mhm.
Yeah, great.
And this is
comments.
Oscar. I just want we know this whole issue of language.
Yes.
You know, it's we keep evolving. I mean, there were days of old we said cultural competency, the cultural sensitivity, and and on and on and on. And and in the mental health field, one of my pet peeves is that every discipline has a different word to describe mental health. And even the word behavioral health becomes very difficult for people to understand. And so, and are we talking physical? Are we talking, mental health, substance use, both? And I don't know if we as a behavioral health community have really understood our own language. And then when we try to get others to understand that language, it does become confused and diffused. So I just put that out there because I understand what everyone's saying, but I also think that we need to hold the mirror in front of our face, mental health professionals, and in some way stop it or get on board. Because if we're trying to promote ourselves to the world, and one who has sat before many legislative committees, they look at you like, what are you talking about? And if you look at the world of intellectual disabilities, they got it. And in fact, many legislators get the two confused, but they're clear about who they are, what they want, and their language. So I'm just saying that's an issue that we have to take some ownership for in terms of how we keep morphing the language, even if it's dynamic and we should change, but at the same time, there are issues with that because nobody understands us. We don't even understand ourselves half the time.
Great comments. Thank you. I am going to, let's look now. These are the discussion prompts for our breakout session. So the second breakout session, you will be grouped with your team. And this is an opportunity to both extend the conversation around the DEIA items, since that was not included in the morning session, because we wanted to have this conversation first. But then also, this is an opportunity, because this is going to be your last breakout of the day, to start thinking about, like, how does this actually apply to my organization? So things like, who would you include in your data collection, which may feel like that's a pretty basic question, but if you're in a larger organization, there may be some questions around where do you draw the line. So for example, I am employed by the university. I have an affiliation and several assignments within the hospital medical system. Those are not the same systems. And it gets very confusing sometimes, where does one group start and the other group end? So sort of thinking about who is my agency, who are my organizations, and where do I want, who do I even want to hear from? And thinking up front, again, before we take any action, what is it, what are our thoughts around addressing comfort and safety for our respondents? How can we create a system that is not, anonymous and or confidential? So anonymous being, you don't know who I am. Confidential being, I have shared something, you may know who I am, but I can be assured that that is not being shared any further. How are you going to share feedback? It's a huge sticking point. We so often survey employees or staff or community, whoever it is, right? We do these surveys and we get all this information and nobody ever hears from us again, right? We've got to share back. This has to be a feedback loop, because it's not collaborative, right? If we're not continuing the conversation. And then we just want to get really concrete as you end your day, right? So for your group, thinking broadly about all of the domains, stepping into organizational well-being, what are 2 actions that you can define today that are going to advance your efforts? And if you really want to be like superstar about it, it's 2 actions, who's responsible for those actions, and maybe even a deadline when those are going to be done, and a report back sort of mechanism. But we want, we always find that in order to push work forward, from these opportunities that we have to spend time with each other and discuss issues, leaving with something concrete makes it much more likely we're going to continue on after. So the prompts have been put into the chat also. And are we ready for our second breakout sessions?
Yes, I believe we are. And
Awesome.
so for we are working to put folks into breakout teams by teams.
Mhm.
It helps if you, again, have your organization added to your screen name. If you don't, just as with the last session, I know some folks are not able to just join or be assigned. We will ask you and put you in your team as we're breaking out. So be patient with us as we try to do this. This is the virtual space of walking to another room. Sometimes we have to give a little assistance or guidance to do so, but this allows you now to have some more team-based discussion to do this. So I think if we are ready, we will go ahead and begin our our team-based chats. And these will be about 30 minutes. We'll come back, maybe not quite that long, but about 30 minutes. Excellent. I see we're coming back here and hopefully off the tail of some great team discussions. I know within the room that I was in, there were lots of questions around the tool, questions around utility, how did these things connect with currently existing tools that folks are already using. I'm going to pause, Kristen, and just to open it up for questions, if we can, that may have come out of that group, and see if there's some folks who have some questions they want to ask now that you've had the chance to meet and discuss it. So anybody want to share some thoughts or questions that came from your team-based discussion?
We did have just a more of a technical question about the rating scale, the assessment. Do you envision this being like a rating, like a 1 to 5, or is it a yes, no, we meet or don't meet the criteria?
Yeah, so the way I did come off mute. Yeah, the way that we're envisioning this is that most items will be a scale, right? Like a 1 to 5. I will be totally upfront in that this is a bit of a process. The initial rollout, and we'll give guidance and tools for this, but it's really the organizations are going to need to collect the information and then input it into the system. There is the Cadillac version of our dreams as we get more funding in the future, that, you know, ideally you could have all of your employees go do some stuff online and the system aggregates it all for you. We're not there yet. So so it's for data collection, right? It would be having whoever it is that you're getting input from complete items on a scale, and then that gets aggregated to give you an idea of where you are or not. I'm not sure if I completely answered your question.
No, you did. Yes, you did.
Yeah.
So Kristen, I think you can see our chat. One of the questions that's come up is taking into account tenure at an organization when getting feedback, or versus new employee who hasn't had time to learn structures in an organization. Will they receive that level of detail in response?
They were not going to, but I love that thought. So we like the information. One of the questions that we're collecting is we've asked folks, are you in a supervisory position or not? Because we thought it might be interesting and meaningful, right, to understand, is this coming from a supervisor's perspective or not? We did not think to ask, how long have you been employed with this agency? And I can like immediately see the utility of that. And I think it's something we should consider adding to the registration survey, definitely. And as folks are thinking or forming questions or maybe typing, I did want to, something kind of jumped off for me in the last session I was at, that, you know, we've talked about these 8 different domains of well-being. Certainly this afternoon was focused on DEIA. And then we come in and we kind of scare you around, you got to be ready, you got to be ready. But what does that look like and how do you get there? So if you're in an organization that you don't feel quite ready to jump into that, whether it's organization specific or you are sitting in a region where you've got some concerns about that, we've got 7 other domains of well-being. And so if the concern is we don't have a good climate in our agency to take on diversity work, then what I would suggest would be one way of going about it. Pick some other areas of well-being. Let's start increasing the well-being across the agency, and then we can come to a space where we're ready to dive into the more difficult, the more personal, right? And so it's not like, oh, we can't do anything. It's like, all right, then where's a good starting point, right? And there may be some easier lift items that we can engage in that work and we can work toward. Now, again, going toward transparency and getting buy-in, and I would want to be open about that process. I'd want to say, look, this is why we selected these couple areas. We decided we were ready to go over here. We're going to get there eventually. We decided there was a little more homework and groundwork that needed to be laid in order to go there.
Yeah, that's exactly where we discussed in the group I popped into, is starting where you're comfortable and where you're able to get a little bit of traction. And that looks different for every organization. That's exactly where we landed on that.
So Kristen, actually, you might be able to help explain this to the group. I'm familiar with other tools that you've developed that work in a similar fashion. Can you explain to the group how then the survey or the tool with the different domains, how it works in terms of then utility, in terms of what people complete, what information they get back? How does that work for them and how they might use it?
So let's just say that there's no more, the items you've seen today, that's exactly what we end up going with, right? I'll be completely upfront. We're still kind of working through exactly what the flow on the website and that portal will look like. But the idea is you'll be able to access each of these 8 domains. They can be done, they don't all have to be done together. So you can pick just one. You can do all 8, you can do whatever order you want to. But that you would look at those questions and the first step is gather that feedback from your organization. And that's where we'll be developing some tools to help you do that, right? So you can put out the survey to your staff and then it gets inputted into the system. And like the other systems you've seen of ours, what it'll do is basically give you so this is where you are right now. And here are some recommendations, responses, intervention to get you, to a better space, to where you want to be. Does that? And Dominique, Oscar, anything you guys want to add to that?
And we'll have resources available. We definitely will have a component of resources that organizations can have access to.
The one other thing related to that is, I know, again, I'm going with the history of some of the other tools. When completing this work into the web tool, it has some tools might be used where the items aren't necessarily distributed via survey to all folks, but a team of people who maybe addresses or answers those using feedback from their organization, but kind of creates this assessment in a smaller team-based way versus all folks within the organization go in and complete it, and it creates the score. In terms of the process, how do you envision that would be done?
Yes, good question. So I kind of envision it in 2 different ways. And our intention is to really well delineate this for folks as they look at it, because there's some items here that you don't need to survey all of your staff. I mean, so around work climate, there's things, like, are your harassment policies like posted? And I can walk through a building, right? And I can see those kinds of things. Are they posted or are they not? There's other things. This has been a huge point of discussion for our group to try to direct a way or just find a way to not allow. Sorry, I'm like very scattered and stuff, but we don't want one organizational leader to be able to go in and answer all the questions, be like, oh, I know how my staff feels. right? I mean, that's going to create its own issue. And so some of these items that you really have to gather from staff perspective, I think the direction we're headed in is we'll create a survey that you could then send out to your staff to gather that information so that you are making sure that you have, you know, kind of broad representation. Now that is something that the organization is going to have to take on at this point, to disseminate that survey, and then however they choose to do that to get those results back and then put it back into the system. I think most items are going to go that way because there's only so much that about well-being that's sort of I can just take stock of the physical stuff, you know, the more objective things. So much of it is subjective.
Using the term organization, but this could be a subunit within an organization.
Mm-hmm.
The way that this works is there's a team leader, and that team leader provides permission, if you will, for others to answer the questions for that team. So it can be large or small. And then as the team enters the data, there is permission given that that data will be aggregated into one report. And that report is anonymous. It just says, this is what your team, be it 5 people or 35 people or 3,000 people, had to say. The issue becomes, in terms of that question, is that the team leader could ask, because in other tools, as we did our research, it appears that a lot of times people want to know the raw data. So you don't get the names of people, but you get the number and some demographics. And that's where it became an issue, because you have 3,000 people and one person is Black or African-American, and they say your stuff sucks, you know, then you're going to automatically know who that is if it's in that quote. You might think you know who it is. And let me say, if it's in one of those sensitive domains, if you will. It doesn't mean it's that person. So we didn't want to out that person. And we had debates about whether we should release the raw data or not. But for every tool that we looked at and all the research that we found, ultimately someone's going to ask for that. So we just built it in. And the other thing I would say is that this is fluid. So if, as we go through the process, and if people want to utilize this tool, we're welcome beyond this meeting for feedback, constructive criticism, negative criticism, and we will make adaptations as we go forward.
Thank you for that, Oscar. I know this is one of those issues we've been talking about a lot, is how do we create the space for comfort and safety in completing and providing the information. One last question that I just have, and these questions come from, clearly I have knowledge and experience in working with some of your tools. So leading these questions where those who don't have the opportunity to have used any of these tools in the past, just to kind of get a sense for how this might look or operate. I know with some of the other tools, what comes or has been a part of those domains are strategic planning guides. So then when given the information, you're given some guidance on how to use it and resources for implementing then strategies related to that. Is this intended to look similar in format to some of those that you've created, and or how do you see that looking related on the back end once the information is provided?
So yeah, great. We'll just name it. So it's very shape-like. If you've ever had an experience with, we also host the SHAPE system, which is specific for schools. So that's one of the systems that Randy is referencing. And if you're familiar with it, we have been thinking about a very, very similar structure, and to include some guides around strategic planning in those resources, right? We could say, oh, we'll provide resources. So those resources might be like ideas how to address this, but also planning guides. Like, so I have now identified organizational and supervisory support as an area of need. what is my step one to get into that, right? Help me start sorting through, how do I begin to address that? So strategic planning guides will be part of that resource bank that we're thinking about.
Excellent.
I will say one of the challenges that we have found, because a lot of our work, and when I say our at the National Center, Dominique and Oscar are firmly embedded in behavioral health, where I tend to have more of a background in schools. And the advantage there is all of your agencies, your school districts, have a similar structure. One of the challenges moving into behavioral health is there's so little consistency in what organizational structure looks like. So we're trying to find that balance of giving clear guidance, but it being flexible enough that it can apply in all of these various sort of types of agencies and different structures.
Thank you for that. I know that we just had some questions come up in the group, and it prompted, we didn't necessarily talk about those similarities or differences, so wanted to ask about those, but I'm going to stop and give pause for other thoughts or questions that groups may have come up with. Let me ask too, as you're thinking about that, where you see utility as you've engaged with the tool and content today. What are your thoughts in terms of utility, or how this might be useful and or not, as Oscar said, maybe not for you. If you have that feedback, would be a great time for this group to be able to hear that.
Well, this is Oscar. You know, as they say, all politics are local. In this case, all things are local in some respects. You know, this was born out of a need from Central East region, which includes the states of Pennsylvania, West Virginia, Delaware, DC, and Maryland, and specifically Pennsylvania and West Virginia. So the driving force for them was we have such a high turnover rate. And the reason why people are leaving is all over the place. It's burnout, it's the lack of resources, it's demand, microaggressions, the changing in populations. And we want to make sure that our infrastructures within our state are healthy and supportive of the workforce. So what we see this as giving people the tools to begin to see where they are on those evidence-based domains, and to be used by the organizations to help them move down, to move up up the line, if you will, in making their organizations more responsive and more welcoming on all those different domains. Now, what you don't see here, and this is an issue, is that for us in Region 3, this is just one part of what we do. So in addition to the tools, we're still going to commit to do face-to-face support and follow-up, because what we found in our regions is that that's still needed and desired. So we're going to be still providing some of that as we go along. So this is not independent for us, it's more inclusive. And we realize that not every MHTTC region can do that, but at least there's a floor, if you will, where people can at least get this information, and hopefully because of their interests, and they're part of that, quote, hallelujah choir, where they want to make changes, that they will take some ownership to do that.
Thank you for that context, Oscar. Any other thoughts? And while we're collecting those, we are going to go ahead and pull up some slides here. Dave, I don't want to call you out, but I do keep seeing your face pop up. It looks like you're eager to say something.
I'm just going to say, I think the questions are great in the survey. You've done a really comprehensive job of identifying these key workplace issues. Each section could be a separate survey in itself, I think, because if you try to give the whole survey, it does get kind of long, and at least in our environment, that might be difficult to get somebody to take the time to fill out the whole thing. But the questions are great in and of themselves. And I also think that it could be used to survey smaller groups or units as opposed to trying to send it out to a large scale organization like the one where I work. So those just a couple of comments, but thank you for sharing this. I think you've asked the right questions. It's just the bigger issue is how do we use this now?
Thank you. It's great comments. And yeah, I know we tend to talk about it as a whole inventory, but I think we really want to encourage folks to start where it makes sense for you, right? And a lot of times it doesn't make sense to try to do this huge, broad 8 domains, particularly given, right, we've all got a lot on our plates. So encouragement to start small. It's better to start small and slow and have success and build for it successfully than to do it all at once and it doesn't go well, right? And we go back to those that, it's a marathon, not a sprint. And when we look at that, the line for the sprint, the productivity line was like up and down and up and down and all over the place. Whereas a marathon, it's going to take you longer, but you're building steadily toward good outcome. So on your screen, we've got the MHTTC evaluation for this training, and this is for day 2 or day 1 and day 2.
Yeah, so if we can for a moment, this will be a survey and evaluation of our day 2 event. One of the things we've asked for your feedback a lot throughout the day and your thoughts and your comments. We very genuinely do value those and use those. And it also helps to sustain our funding. So if you enjoy free training and events and tools being developed for you, please fill out this survey for us. It is very, very brief, but it allows us to continue to maintain funding through SAMHSA as our organization. So you can use the QR code, you can use the bit.ly here. It's been provided in our chat feature as well. I believe attached with that evaluation are also an evaluation that you can provide for Kristen and her team related to the content provided today around the tool. So there might be a few additional questions related to that's been added to our survey. But again, this helps us to maintain the funding to continue to be part of the network and do the work that we all do. I'm just going to end on the comment today that was brought up, as you mentioned, Kristen, about sprints and marathons, and Dave, as you mentioned too, being able to do things in part. We've heard and discussed this, that some of the frustration that can happen sometimes on our teams and with our organizations is this survey fatigue and then feeling like it doesn't go anywhere. We talk a lot about work, we get excited about it, we feel like our feedback is going to be used for something, and then we never hear back again. And that actually the design of this tool and the different domains allow us to be able to break some of this down into digestible pieces and do maybe some segments of success. If we can keep some things focused and we can keep those feedback loops shorter and smaller, then maybe again, we might help to be able to see some of that success happen with implementation and some of those changes if they're focused. I just want to, I want to thank you, Kristen, Dominique, Oscar, for sharing this work that you've been working very hard on with all of us as part of this symposium. We definitely wanted to make sure that we could highlight the work of our colleagues, this important work that you have done. I believe I don't want to set a date for you, but the rollout of the tool will be this fall, correct?
It will be this fall. Yes, so the website will go live for the individual side if you have interest or curiosity in that around September 1st. And then right now we're looking at mid-October for the organizational side. When you get sent the materials from the training today, because I know we're at times, I don't want to take any more time, but one of the things I'll include is I have a link that you can put your email address in and we'll notify you when it goes live. So and of course we'll put it out through networks also, but if you want to just make sure you get that personal, yep, we're good to go here. That survey will be there. Then also on your PDFs, there were those bit.ly links. If next week you're like, oh, I wish I had said, those links are going to remain active. Feel free to go back, put more feedback, whatever you'd like, or drop us emails. We do really appreciate the feedback, because even just some of the questions that were asked today, like we're already kind of like, ooh, that's a good thing. We need to adjust and we need to include. So this has been super helpful for us also.
Yes.
We really appreciate the opportunity to come share this work with y'all.
Yeah, and I think another thing we were thinking about doing, I don't want to scare Chris here, is that, because we're not going to go live, if you will, with the organization till we're thinking about whether we need to give some instructions or introductions to organizations, because as you can see, there are questions and thinking that has to go on, and we're not expecting the organization on day one to just jump in, but there may need to be some preparatory discussions with the organization about, is this what we want to do? Do we have an issue? Which one of the domains we want to focus in on? Who are the team members we have? What are we going to do with the results? How do we deal with this? How do we deal with that? And so there may be some time, maybe 3 months, maybe 6 months, that the organization really has to think through what it wants to do. And like you asked, Brandy, what's the utility of this for the organization before they jump into actually taking, filling out the tool. So we're going to help organizations to understand that as well, that, they may want to just think about this for a minute and figure it out for themselves, knowing what's available, but then how do you implement that even before you take the test, so that you don't build up expectations, but also you make it meaningful to you, the organization.
Excellent. Thank you for that, Oscar. Thank you for this connection and these resources. Just a reminder, we will be getting all of the recordings and slides out to you. They are available on our website. Stay connected, because you can see more is yet to come. So join us on our social media handles, join your listservs for your regions. Again, thank you for your feedback. If you haven't yet, please fill out our survey before you end the day. And with that, I will say, be well and enjoy your weekend. Thank you, everybody.